I'm going to wash my hands first. Okay, so I'm going to be doing a preliminary MAR review for Dakota Smith today. So I'm just going to do my checks. So I'm doing Smith Dakota, 2 pages. Diagnoses is PVD and CHF, no known allergies, no new or any discontinued meds, and no drugs have been signed off for. Okay, so I'm going to check if my orders are complete. So I have 3 drugs here. For this video, I'm only going to be pouring betamethasone 0.1% cream, but I'll check all of them. Betamethasone 0.1% cream, applying sparingly to affected areas twice daily until clear at 0800 and 2100. Digoxin 0.125 milligram tablets. Give 1 tablet PO daily at 0800 and 1630. Furosemide 40 mg tablets. Give 1 tablet PO daily at 0800 and 12 o'clock. Okay, so all my orders are complete, and I'm going to be giving betamethasone 0.1% cream, as I said, for a rash in the left lower leg, right here, at 0800, and I also assessed this rash at the start of my shift's QPA. Okay, and now my planning. So betamethasone is the generic name, Betaderm is the brand name. It is used for inflammatory and pruritic dermatoses, and it inhibits synthesis and release of destructive endogenous agonists responsible for inflammation. It also reduces leukocyte adhesion to capillaries and stabilizes lysosomal membranes. It also retards migration of macrophages to areas of inflammation by vasoconstriction, lower capillary wall permeability, and subsequent edema reduction. Some side effects include allergic contact dermatitis, burning, irritation, dryness, atrophy, folliculitis, hypertrichosis, hypopigmentation, maceration, miliaria, striae. So some nursing management, I need to assess for history of hypersensitivity, and if the affected area is open and weeping, I shouldn't apply this betamethasone 0.1% cream. I have to be cautious of infection and long-term therapy. I also have to educate my patient that they should comply with the prescribed drug regimen, avoid exposure to infection, and notify providers of slow wound healing and fevers. Okay, so during my pre-assessment, Mrs. Smith told me about her rash in the left lower leg, and I also confirmed it as well by assessments. And for post-assessments, I'll be going to Miss Dakota's room throughout my shift, assessing for any side effects, and I'll also be educating Mrs. Dakota of the side effects that she should look out for as well. Okay, so now I'm going to gather my supplies. So I need my ointment, and I also need a applicator stick, some hand sanitizer, and gloves, as well as a way to dispose everything that I used. Okay, so now I'm going to be doing my first two checks. So Smith Dakota, and betamethasone 0.1% cream. Apply sparingly to affected area twice daily until clear. And I'm doing it for 0800 on October 23rd. So October 23rd at 0800. And betamethasone 0.1% cream. Apply sparingly to affected area twice daily until clear at 0800 on the 23rd. Okay, so do my second check. Smith Dakota, betamethasone 0.1% cream. Apply sparingly to affected area twice daily until clear. Betamethasone 0.1% cream. Apply sparingly to affected area twice daily until clear. I'm doing it for 0800, and the expiry is 0123, so it's still okay to use. Okay, so now I'm going to be locking my medication. So now I can go to my client and I can say, introduce myself if I haven't already, done my QPA. So then I will confirm their identity by checking their armband. So I know their name, date of birth, and PHN. So I can also ask them what their name is and their birthday, if possible, and then I can compare it to my MAR. Everything looks good. Smith Dakota, birthday 16/10/1950, and patient number 6171823. It's not the same, but I think it should have been. So now I can expose the area of my client. So that's their left lower leg for a rash, and confirm the site and see where it is. So it looks like it is right here. And I'm gonna wash my hands first. I'm going to put on my gloves. This is my bedside table. I'm going to open my medication and take a little bit, just what I need. Apply some. I'm going to take some of that cream, apply sparingly on Mrs. Smith's rash in even layer, and I'm not rubbing it in. Okay, so now I'm going to doff my gloves, dispose, wash my hands again, take this, dispose of it, close this up here, put everything away in its proper place. I wash my hands, and then now I will document. So I have this right here, and that is October 23rd, betamethasone, 8 o'clock for Dakota Smith.